You've probably already contributed data to an online map, maybe,
Mm.
or perhaps volunteered for like a local community project.
Yeah, or even just shared health experiences online somewhere.
Exactly. So what if that kind of everyday thing you do could directly influence actual health research and maybe even help shape public policy?
That's really the powerful idea behind what's called citizen science, especially now as we're seeing it move much more into public health.
Moving beyond just like counting birds.
Right, exactly. It's about bringing the public, everyday people directly into the science stuff, not just as subjects, but as active partners.
And that's precisely what we're going to dig into today. We've
Mhm.
got this really fascinating stack of sources you shared. There are scoping reviews on citizen science and chronic disease prevention, another on mental health.
Yeah, and one looking at using tech for physical activity promotion, plus some important pieces on ethics and this critical look at how we even measure the impact of public involvement.
So our mission really is to unpack all this. We want to get a handle on what citizen science in health research actually looks like, on the ground.
What its potential is, where it's being used, the real challenges it faces.
And ultimately what it all means for you, the listener, trying to make sense of all this health information out there.
Okay, so let's jump right in then.
At its core, based on these sources, what is citizen science in a health context?
Well, the definition they use is pretty clear. It's the voluntary participation of non-professional researchers, basically. Citizens, the lay public in scientific activities, and often they're collaborating directly with professional scientists.
Right. And you mentioned its origins more in natural
Yeah,
sciences.
exactly. Things like tracking bird migrations, maybe monitoring local water quality, that kind of thing. But it's seen this really rapid growth in public health recently.
And the sources they mention, it overlaps with other approaches, right?
Mm.
Like community-based participatory research.
It does. CBPR, where the community are seen as sort of equal partners throughout, that's very related. And even things like large-scale crowdsourcing, there's common ground there.
But the key idea, it seems, is really about intentionally harnessing
Yeah.
what? The effort, the knowledge people bring.
Precisely, harnessing the effort, the insights, and that really unique experiential knowledge that community members have, stuff that researchers, frankly, might not get any other way.
So why now? Why this big push for citizen science in public health specifically? The sources seem to lay out some pretty compelling reasons.
Oh, definitely. There are quite a few big opportunities identified. For one, it can really strengthen prevention initiatives, make them more relevant on the ground
I so.
by helping generate new knowledge that directly tackles real-world health problems people are facing. It can also, mobilize public support for taking preventive action in their own communities.
And it gives people a way into policy discussions.
Yes, that's crucial. A pathway for the public to get meaningfully involved in those policy processes, which helps make sure that the research and whatever actions come from it are actually relevant to what communities need.
So it's about shaping policy, shaping practice more broadly.
Absolutely. And fostering that meaningful public engagement isn't just like a nice to have, it can make interventions work much better. Plus, it really strengthens those partnerships between citizens, researchers, doctors, policymakers.
Hmm.
One source, the one looking at mental health, really hammered this home. It talked about the huge global burden, the need for disruptive innovation,
Hmm.
and citizen science was highlighted as a way to tap into that incredibly valuable lived experience knowledge.
Right. The knowledge from people who've actually been through it.
Exactly.
Okay, let's dig into that chronic disease prevention angle more deeply, based on that big scoping review you share.
Right. The one that looked specifically for studies using the term citizen science,
Yep.
focused on prevention, and reported on, actually applying or evaluating it.
So they filtered out things like general reviews or studies just on, say, environmental health.
Correct. They ended up with 81 articles, which gives us a pretty solid picture of that particular area.
81. And what did the trend look like?
Well, what's really striking is the growth. A basically exponential increase in publications using this approach in prevention since about 2011, but with a huge jump, especially in 2020 and 2021.
Wow. So it's really taken off recently.
It definitely seems to be gaining serious momentum, yeah.
And where was this happening mostly, geographically?
Predominantly in high-income countries. The U.S. led the way, then the U.K., Australia, Canada, Denmark. A few multi-country studies, too, but that's where the bulk of it was.
Okay. And within prevention, what specific topics were they tackling?
Physical activity was the big one. That was in almost half the studies, 46%. Nutrition was next, around 17%.
But it wasn't just those.
No, it covered a wider range too. Things like mental health components within prevention, health and sustainability links, specific conditions like obesity or diabetes, substance use, healthy workplaces, and just broader community health initiatives.
So, moving beyond the numbers, what were the citizen scientists actually doing in these projects? It wasn't just filling out surveys, presumably.
No, definitely not always. The sources described quite a range of roles. Data collection, yes, that was very common.
How was that done? Apps? Face-to-face?
Both, really, often through apps or online platforms, especially in the bigger projects, but sometimes it was face-to-face, particularly in smaller, more local community projects.
And you said it went deeper than just collecting data.
Oh, absolutely. Especially in those smaller community-rooted projects, citizen scientists were often involved in actually analyzing and interpreting the data they'd collected.
Really? Analyzing it themselves.
Yeah, and helping brainstorm solutions, developing recommendations based on the findings. Some even got involved in spreading the word, disseminating findings, and advocating directly with policymakers.
Okay, that's much more involved.
Yeah.
Can you give us an example or two that brings that to life?
Sure. There was one study with older adults at a senior center in Australia. They didn't just, answer questions. They actively went out and identified the barriers and facilitators to walking around their own center.
Things like cracked sidewalks or lack of benches.
Exactly. Then they analyzed that data together and used their findings to push for specific changes with local policymakers.
So using the research process itself as a tool for local change.
Precisely. Another really powerful one was the Healthy Communities Project in England. Residents were trained as citizen scientists. They collected data on local healthy eating and activity issues. Then they co-produced solutions with community organizations and actually implemented them.
Co-produced and implemented.
Yeah, and get this, it started with just 4 participants, but grew to 4,000 over 7 months.
4,000. Wow, that's incredible growth.
Yeah.
Shows real community buy-in.
Totally. And one more great example from the Karuk tribe in California. This involved adolescents. They weren't just subjects. They were involved in co-creation right from the start.
How so?
They got research and leadership training. They formulated their own research questions, designed studies, collected and analyzed data, and then presented the recommendations directly to the tribe's decision makers.
That sounds like real partnership.
It really does. True co-creation.
Okay, so moving on to whether this actually, works. Feasibility, utility, did the sources look at that?
They did. About 43% of the projects in that chronic disease review specifically reflected on feasibility and utility.
And the verdict?
The general consensus was pretty positive. Researchers felt that citizen science is definitely feasible and offers real utility for public health prevention.
What were the main benefits they pointed to?
They highlighted things like generating richer data, getting unique perspectives you might otherwise miss. It helped identify diverse, community-focused solutions, the kind that are more likely to stick.
Okay.
And it could also be a catalyst for community action, helping build crucial new partnerships.
And what made these projects successful? Were there key ingredients?
Yeah, some themes emerged. Strong relationships with policy and practice stakeholders right from the beginning seemed key.
Getting them involved early?
Exactly. Building solid connections with community partners and working with dedicated community champions, people within the community who could help rally support and keep things going.
Makes sense. But of course, it can't all be smooth sailing. What were the main challenges or hurdles they identified?
No, definitely not always easy. Challenges are real. Difficulties recruiting large enough or diverse enough. Samples came up frequently. Representativeness is tricky. There's also the burden on the citizen scientists themselves, the time commitment, the energy, the capacity required. Researchers need to be really mindful of that, not just extract effort.
Technology barriers, too. You mentioned apps.
Yes, technological constraints were a big one. Digital exclusion, people lacking reliable internet or maybe the digital skills needed, that's a significant barrier, especially if you're relying heavily on apps. And resourcing issues. These projects, especially the intensive or long-term ones, need proper funding and support.
Okay, so despite the challenges, did these prevention projects actually lead to changes? Policy changes, practice changes. That's often the big goal, right?
It is. And according to the review, yeah, a good chunk of them did. About 45% reported tangible policy or practice impacts.
Nearly half. It's pretty significant.
It is, and importantly, most of those successful projects were the ones that had actively involved policymakers and community organizations right from the planning stages. It reinforces that partnership point.
So what kind of impacts are we talking about?
A real range. Sometimes it was successful implementation of a new policy. Other times, the citizen-generated evidence directly informed government priorities or how resources were allocated.
Okay.
In some cases, it led to developing entirely new programs or securing new funding. And very often, it resulted in the direct implementation of community recommendations.
It's like actual physical changes.
Exactly. Things like getting a community garden started because people identified food access as an issue, setting up local cooking lessons, installing new bike racks when people said they needed them, fixing street signs for safety, or repairing footpaths to make walking easier and safer.
Those sound incredibly concrete, real, tangible local wins.
Totally. There was one study on alcohol-related harm. The priorities identified by citizens were actually accepted by policymakers and directly informed further investment in those specific areas. Another project used citizen science to build community support for a physical activity program. That support led to the program getting refunded and scaled up. And a key outcome they mentioned was just strengthening the relationship between the community, policymakers, and the researchers.
That improved relationship itself is valuable.
Absolutely. The sources really stress that, building trust and better communication between the community and local government, for instance.
It sounds really promising,
Yep.
but the sources also mentioned a kind of trade-off, something about engagement depth versus scale.
Yes, this is a really important nuance they highlighted. Generally speaking, the larger projects, the ones recruiting hundreds, maybe thousands of people, tend to be more contributory, meaning the main role for citizens is often focused on collecting large amounts of data. Think crowdsourcing observations via an app.
Okay, and the smaller projects?
They tend to lean more towards a collaborative approach. They might involve fewer people, but those citizens are more deeply involved throughout the whole process.
So, involved in designing the study, analyzing data, advocating.
Exactly. Analysis, interpretation, shaping recommendations, leading advocacy, much deeper engagement.
Which sounds, as you said earlier, much closer to that community-based participatory research tradition where community members are really seen as partners.
Precisely. It values them as partners from start to finish.
But the potential is there for large and collaborative.
That's what the sources suggest. There's still huge untapped potential, especially using technology, to create large-scale projects that are also highly collaborative. Projects involving thousands, but still empowering them in analysis and action, not just data collection.
How would that work?
They mentioned examples using things like mobile apps combined with, say, gamification, not just to collect population-level data across whole communities or countries, but also to facilitate deeper engagement and collaborative problem-solving at scale. That's kind of the next frontier.
Okay, fascinating.
Huh.
Let's shift gears a bit now to the other major area. You mentioned mental health research. You shared a systematic review focused specifically on that.
Yes, and this review really set the stage by talking about the massive global burden of mental ill health, the historical underinvestment in research compared to physical health.
And the need for innovation.
Exactly. A strong call for disruptive innovation, again, highlighting that critical role of leveraging lived experience.
So how did they approach this review? Similar methods.
Pretty similar. A systematic search across major databases, Gray literature, looking for studies explicitly using citizen science and mental health, and they analyzed them based on established principles from the European Citizen Science Association, ECSA.
Okay. And what did they find? Was it as widespread as in chronic disease prevention?
Well, this is where it gets really interesting and shows a major difference.
How so?
Despite that clear need and the theoretical potential, they only managed to identify and include 9 studies globally.
Only 9. Seriously. Compared to 81 in chronic disease prevention.
Exactly. It's a stark contrast. It strongly suggests that, while it's feasible and definitely holds promise, citizen science and mental health research is still very much in its early stages. Infancy, really, compared to other areas like physical activity.
Wow. Okay, so what did those 9 studies look like?
They were all conducted in high-income countries, similar to the prevention studies. The citizen scientists involved were often individuals with lived experience of mental health conditions themselves.
And what roles did they play?
A mix. Data collection, analysis, helping design the project, some leadership roles, helping disseminate findings. But the review did note that the reporting on how these projects actually aligned with those formal ECSA principles was often a bit unclear or inconsistent.
Were there specific challenges or issues that came up that seemed particularly relevant to the mental health context? Maybe different from studying, say, walkability?
Yes, the review did highlight some unique points. One concern raised in some studies was the potential for unintentional bias. Researchers, in how they frame tasks or questions for citizen scientists, could subtly influence their contributions.
Need to be careful with framing.
Definitely. They also found that just having more participants didn't automatically lead to better research outcomes. The quality and the level of engagement seemed more critical and perhaps more complex to achieve in mental health contexts.
That makes sense. Just having numbers isn't enough if people aren't genuinely engaged or supported.
Precisely. And that leads to another crucial point, especially for mental health research. The huge importance of fostering high-quality, supportive relationships within the project. This was seen as vital for the citizen scientists' own mental well-being and their sense of belonging in the project.
So the process itself needs to be supportive.
Absolutely. They also noted external factors could really influence how empowered participants felt. And yes, potential conflicting interests between stakeholders, academics needing publications, political bodies with agendas, citizens with their own priorities. That tension can exist.
Any practical challenges, especially with digital projects?
Yes, one practical issue that came up in some digital mental health projects was the need for moderation. Dealing with instances where participants posted hostile messages or maybe unsolicited and potentially harmful health advice to others, that required careful management and resources.
Right, online spaces need careful handling. What about data quality in these mental health studies? Was that a focus?
Yeah, the sources mentioned that getting high-quality data often needed large and diverse participation, which could be a challenge given the low number of studies overall. Sometimes specific training was needed for the citizen scientists to ensure consistency.
And moderation helped.
Yes, strategies like having separate online chat rooms for different project groups or active moderation of contributions were found to help improve the overall quality of the data collected.
Looking at the bigger picture impact, what did the mental health review suggest citizen science could potentially achieve in that area?
The potential impacts were quite broad. It could act as a catalyst for collective action within communities dealing with mental health challenges. It showed promise for influencing healthcare policy related to mental health.
Supporting self-management, too.
Yes, supporting mental health care self-management, especially through digital tools, contributing to best practices in digital health overall, and helping create mental health interventions that are scalable and replicable, potentially using digital platforms.
Okay, so let's try and pull back now. Looking across both prevention and mental health, based on all these sources, what are the big overarching challenges and opportunities for citizen science in health?
Okay, yeah, summing up, key challenges that cut across. Still a bit fuzzy on the definition, right? Lack of one single agreed-upon definition of citizen science makes comparing studies tricky sometimes.
Right.
Digital exclusion is a major, major barrier. It risks leaving out important groups, especially in lower resource settings, and that initial investment. While it might save costs down the line, getting started takes time, resources, capacity building, that can be a big hurdle.
Okay, those are significant hurdles.
Yeah.
But the opportunities, they still sound pretty compelling.
Oh, absolutely. The potential is huge. Generating incredibly valuable, unique, diverse data that researchers just couldn't get otherwise.
Efficiency gains, too.
Yeah, increasing efficiency by having citizens help with things like data collection, maybe even analysis, potential for cost reduction in the long run, despite that initial investment. And really importantly, it enhances the health literacy and scientific literacy of the citizens who participate.
Which is a massive benefit in itself, bridging that gap between science and society.
Exactly. And fundamentally, it can be a powerful tool for empowering individuals and whole communities.
So what's needed to help it flourish?
Well, the sources suggest a real need for specific funding streams. Funding that explicitly recognizes and values the broader societal impact, not just traditional research papers.
Valuing the process and community outcomes.
Precisely. And there's also a clear desire for more shared platforms or tools, places where researchers and citizens can easily exchange experiences, share methods, learn from each other's successes and failures.
Okay, let's make this even more concrete. The sources highlighted one initiative in particular that seems to tie a lot of this together. The Our Voice framework and its discovery tool.
Yes, this is a fantastic practical example. It's an initiative specifically designed to combine technology, mobile tech with that by-the-people citizen science approach
And the goal.
to increase physical activity at the population level, with a particular focus on communities that might have fewer resources.
So how does it actually work? What do people do?
It uses a mobile app, the Discovery tool. Residents use it to basically assess their own local environment. They collect data, photos, observations on things like sidewalk quality, park access, safe street crossings, healthy food options.
All of the stuff that impacts how easy or hard it is to be active right where they live.
Exactly. And the framework explicitly positions this as a by the people process. It's about assessment, yes, but also about engagement, advocacy, and ultimately driving action based on what they find.
And the sources gave some really impressive examples of the impact these Our Voice projects have had, right?
They really did. Truly compelling examples. One was at a senior housing complex in East Palo Alto, California. Residents used the tool, collected data about their surroundings.
Okay.
Then they formed an advocacy team. They built a relationship directly with the city's planning department. And this wasn't just, having meetings. It resulted in the city allocating $1 million.
$1 million.
Yeah.
Based on the residents' data.
Yes. For planning updates that specifically incorporated health, for sidewalk inventory and repair based directly on what the residents identified. It also led to a community garden and cooking classes they wanted.
That's incredible. A direct line from citizen data to major resource allocation.
It really shows the potential agency. Another great example involved Latino residents in Northern California adolescents and older adults working together. They used the tool to map barriers and supports for physical activity.
And engage policymakers.
Yep. Their engagement led to forming a dedicated community advisory board and creating a community resource guide based entirely on their findings.
And there were measurable changes in how people felt, too.
Yes, the sources reported statistically significant increases in how residents perceive their neighborhood cohesion, how connected they felt, and also their sense of agency, their belief that they could actually influence local decisions. That's huge.
An impact on well-being and empowerment, not just policy.
Exactly. And one more quick one. Seniors looking at food access in Northern California, they used the tool, identified issues like poor variety and high prices locally. Their advocacy, armed with this data.
Led to changes.
Yep. Changes like better street signage and curb repairs near their housing to make getting to the shops easier and safer.
Practical local fixes.
And they didn't stop there. They used their organized effort and data to advocate at the state capitol for funding for affordable senior housing.
Wow. From local environment assessment to state-level advocacy.
It really shows how these structured citizen science approaches, especially with tech support, can translate local observations into pretty significant policy and environmental change.
Okay, so we've seen the potential, the applications, the results, which are often really impressive. But one of the sources you shared brings in a really important critical lens. It raises some fundamental questions about how we even approach public involvement in research, and especially how we measure its success.
Yeah, this commentary piece is really thought-provoking. It argues that the very strong focus within health research, specifically on measuring impact, might actually be distorting how we think about and practice public involvement.
Distorting how? How could focusing on impact be a bad thing? Isn't that the point?
Well, their argument is that by equating impact almost exclusively with benefit, usually benefit to the research project or its outcomes, researchers might inadvertently become blind to potential negative impacts or unintended consequences for the public members involved.
Ah, okay. So assuming it's always positive might make us miss potential downsides or burdens.
Exactly, or misunderstanding the experience from the participant's perspective. The commentary suggests that instead of only seeing public involvement as like an instrument to get better research results.
A means to an end.
Right. We should also see it as a valuable social practice in its own right. A process of dialogue, mutual learning, maybe contributing to social justice, human rights, fostering genuine empowerment. In that view, the involvement itself has value. It's an end in itself, not just a tool for the research.
That's a very different framing. And the source also mentioned the representativeness issue again, the unrepresentative minority.
Yes, it brings that up as a key challenge tied to this. It points to studies suggesting participants in these initiatives often still tend to be from specific groups, frequently white, middle class, retired, maybe with existing health or research knowledge.
Which raises the concern that the people who might benefit most from shaping research underserved populations might be getting left out.
Precisely. That's a major equity concern.
So this critique is basically calling for a more critical look at the whole enterprise.
Yes. It calls for a more critical research agenda about public involvement. One that actively digs into the power dynamics within projects, asks what empowerment really means in this context, and whose interests it ultimately serves. And, importantly, investigates potential harms or challenges just as rigorously as it investigates benefits.
So stepping back and questioning if our current ways of measuring impact really capture the full picture.
Exactly. Does the language of impact fully capture the value, the complexity, maybe even the messiness of genuine public partnership? It's a call for deeper reflection.
That definitely adds a lot of necessary depth. It's not just about celebrating the successes.
No, and it's crucial for making sure citizen science in health grows responsibly and ethically.
Okay, so as we wrap up this deep dive, we've really covered a lot of ground. We've looked at what citizen science is, explored its growing role in huge areas like chronic disease prevention and mental health.
Seen some really compelling, concrete examples of how citizens are getting involved, collecting data, analyzing it, advocating.
And the tangible impacts they're having on policy, on their local environments. We've also acknowledged the very real practical challenges: recruitment, resources, technology.
And importantly, we've taken that critical look at the ethics, the power dynamics, and even how we define and measure success when we involve the public.
So the takeaway seems to be what? That it's complex but promising.
I think that's fair. Despite the hurdles and the absolute need for careful, thoughtful, ethical implementation, citizen science offers this really powerful, potentially transformative way forward.
How so?
It can make health research more relevant, potentially more efficient, certainly more creative, and much more deeply connected to the actual people and communities it's supposed to serve.
Right. Which leaves us with a final thought for you, the listener. You're navigating all this information, thinking about how knowledge gets made and used.
So given everything we've talked about today, the incredible potential, but also the important challenges and critical questions.
How might you see yourself, or maybe people in your own community, potentially engaging with health research or local health issues in this kind of citizen science way? And perhaps more pointedly, what steps might be needed, right where you are, to help bridge that gap between scientific knowledge and meaningful community action?